Okay, and another question then about stage 4 colon cancer. What is the normal process of treatment? Surgery first or chemotherapy first? What are the pros and cons? So that's a very good question. Today we're finding more colon cancer. We're finding more at an early stage, but sometimes people are diagnosed with colon cancer at stage 4 where it's already spread. And that may happen because people had some blood in their stool, or they may become anemic from blood loss, and their hemoglobin is low, and then they go to the doctor, and the doctor sends them for a colonoscopy, and they're found to have a tumor. But if you do a CAT scan, you find that it's spread to the liver, for example, and most commonly. So in that situation, the question is, do you need to have surgery? Because surgery can't really cure you. If you do surgery, it's just going to be to remove the colon primary tumor, but you're still going to need chemotherapy for the liver. What we've discovered in a number of clinical trials over the last few years is that the chemotherapy works very well for controlling the colon primary as well as the liver metastases, and therefore, in most cases, it's perfectly okay to start with chemotherapy and not have to delay the chemotherapy by doing surgery. If the concern about not doing surgery is that if the tumor continues to grow, you may land up with a blockage in your colon, what we call bowel obstruction. And that presents a bigger problem because you may need emergency surgery. But that really doesn't happen very often, less than 10% of the time in these treatment clinical trials where they've looked at this. So most of the time, even if you have stage 4 colon cancer, you can begin with chemotherapy and not need surgery right away, and possibly you may never need surgery because frequently the primary tumor shrinks quite a bit with chemotherapy.